Have you ever wondered what would happen if you had a heart attack while alone at home, with no one around, no one to call for emergency help? Millions of people over 60 live alone. They still cook for themselves, go for walks, watch the evening news, but few think about the emergencies that could strike at any moment, like a heart attack. And in that moment, what you know could mean the difference between life and death. The story of John, 72, who lives in a small town in Texas, is a powerful reminder. One March morning, while making coffee, he felt chest tightness, broke out in a cold sweat, and had difficulty breathing. No one else was home, but instead of panicking, he did one simple thing: sat down, breathed deeply using the 4-to-6 rhythm, and called emergency services immediately. That calmness and knowledge saved his life. The truth is, many people don't know how to recognize a heart attack, or worse, they think it's just ordinary fatigue. They hesitate, then collapse. By the time help arrives, it's too late. But you don't have to be one of them. Just knowing a few simple tips, like proper breathing, the sitting position that reduces pressure on the heart, or keeping an emergency phone within reach, can double your chances of survival when a heart attack strikes. If you're over 60 and living alone, this video will share with you 7 survival tips that cardiologists and emergency experts strongly recommend remembering. Things that may seem small, but could become your lifesaver at a critical moment. Watch the full video, hit the like button, and share it with your loved ones, because you never know who might need it tomorrow. If you've had a similar experience or have more useful tips, share them in the comments below. Your words could help save someone else's life. And now let's begin this journey. A journey of survival, not just to get by, but to live more fully with each passing day. Each year in the US, over 800,000 people suffer a heart attack, and sadly, many of them fail to recognize the early warning signs. They mistake it for simple fatigue or a harmless feeling. But the truth is, our bodies often send very clear signals. We just don't know how to listen. Have you ever felt a heaviness in your chest, like someone was pressing down on it? Shortness of breath when climbing stairs, or even just while changing clothes? Or a dull ache spreading to your shoulder, neck, jaw, or arm? Sometimes it's unexplained fatigue, cold sweats despite normal weather, or sudden nausea. These symptoms, when whether fleeting or mild, can all be warnings from your heart. Cardiologists always emphasize that heart attacks rarely strike suddenly like in the movies. They often begin with subtle, hard-to-recognize symptoms. This is especially true for older adults, women, or people with underlying conditions like diabetes, where the signs are easily mistaken for just aging or feeling a bit off. The most important thing to remember is, don't try to endure it. If something doesn't feel right, that's exactly when you need to act. Waiting for symptoms to pass may cost you the precious chance to be saved. When it comes to heart disease, every minute counts. Every minute can save your heart or cause it to stop beating forever. Here are the common signs you should remember and keep visible: a feeling of pain, pressure, or heaviness in the chest, lasting for several minutes or coming and going. Shortness of breath, even while at rest. Pain radiating to the shoulder, neck, jaw, or arm, usually the left side. Extreme fatigue despite little physical activity. Cold sweats, dizziness, nausea. If you experience any of these symptoms, stop what you're doing, sit down, and call emergency services immediately. Don't delay, don't wait, just to be sure. With heart conditions, the sooner you act, the higher your chance of survival. You may worry about bothering others or fear calling for help unnecessarily, but medical professionals would always rather respond to a false alarm than miss someone who truly needs help. No one will blame you for being cautious. In fact, they'll be grateful that you knew how to value your own life. Right now, save this list of symptoms to your phone, stick it on your fridge, or print it out and keep it by your bedside. If you live alone, share this information with your family and friends, because you might be the one who saves them in an unexpected moment. And the next time your body signals something strange, a rapid heartbeat, chest heaviness, or simply that nagging feeling that something's not right, trust your instincts. Don't ignore it, because it might be your first and last chance to hold on to your life. Every second during a heart attack is precious. And the first thing you need to do is not to look for medicine, not to find water, but to call emergency services immediately. Just by dialing 911, you will be connected to emergency medical services within seconds. But many people, in confusion or hoping to wait a bit to see, miss the most critical opportunity to be saved. You are not alone in that emergency moment. Even if you're home by yourself, even without family nearby, there is a healthcare system designed specifically for that situation. When you call 911, you're not just calling for an ambulance. You are activating an entire rapid response system, from a dispatcher guiding you over the phone to a medical team arriving within minutes. Here's a fact few people know. Most deaths from heart attacks don't happen in hospitals. They happen because the patient arrives too late. They try to drive themselves, endure the pain, or wait for the symptoms to go away. But the heart doesn't wait. The longer the delay, the more irreversible damage is done to the heart muscle. Remember this rule. Never drive yourself to the hospital if you have signs of a heart attack. The reason isn't just the danger of driving in a compromised state. It's because you could lose consciousness at any moment, putting yourself and others at serious risk. An ambulance isn't just transportation. It comes equipped with breathing support, defibrillators, and trained personnel ready to intervene from the very first minute. If you feel hesitant about bothering others or calling unnecessarily, think of it this way. Healthcare workers would rather show up and find you okay than arrive a few minutes too late and be unable to help. No one will fault you for calling emergency services too early, but many heartbreaking stories begin with calling too late. And if you do face an emergency, here are the specific steps you should take. 1. Call 911 immediately. If possible, use a landline or put your phone on speaker. 2. Clearly state your address and describe your symptoms in as much detail as possible, e.g., I have chest pain, shortness of breath, cold sweats. 3. Do not hang up until you receive clear instructions. The dispatcher may guide you through the initial steps to manage your situation. 4. Do not drive yourself. Do not wait for a family member. Do not delay. Timely emergency response can make the difference between full recovery and lifelong disability, or worse, not recovering at all. You might think, I can still handle it, or I'll wait a bit longer. But your heart doesn't need you to be strong. It needs you to be wise. Life doesn't wait, and a single 911 call could be the most important decision of your life. In the first minutes of a heart attack, one small action can make a big difference. Chewing a 325 milligram aspirin tablet. If you're not allergic to aspirin, this could be a life-saving dose, and what's remarkable is that it can be done right at home, even before the ambulance arrives. You're not alone if you didn't know this. Many people, including those who have had heart conditions, haven't been clearly informed about aspirin's role in heart attack emergencies. But medical experts from the American Heart Association strongly recommend it. Chewing an aspirin as soon as heart attack symptoms appear can help prevent blood clots from forming, keep blood flowing to the heart, and reduce heart muscle damage. Why chew instead of swallowing whole? Because when chewed, aspirin is absorbed more quickly through the lining of the mouth, beginning its blood-thinning effect within minutes. If you swallow it whole, the tablet takes longer to break down and absorb through the stomach, and during a heart attack, every minute counts as a chance to survive. This is not a miracle cure, but it's a powerful, simple, and easy-to-perform tool. One small tablet can help clear a blocked artery while you're waiting for the ambulance. It doesn't replace medical treatment, but it can help hold the line until professional care arrives. Here are the specific steps you should remember. 1. Keep 325 milligrams aspirin on hand at home, in a visible place, in your medicine cabinet, bedside table, or a bag you often carry. 2. At the first sign of a suspected heart attack, take one tablet, chew it thoroughly, then swallow. 3. Do not use if you have a history of aspirin allergy, severe stomach ulcers, or medical contraindications. In that case, speak with your doctor in advance to find an alternative plan. 4. Do not substitute aspirin with other pain relievers like ibuprofen or acetaminophen. They do not have the same blood-thinning effect in cardiac emergencies. You might think, can one little pill really make a difference? But in emergency medicine, sometimes a small action at the right time is the only thing that separates survival from tragedy. Just like a small life jacket can keep you afloat in open water, a single aspirin can help keep your blood flowing while your heart is under siege. Today, you can take action. Check your medicine cabinet, buy a few 325 milligram aspirin tablets, and label the packaging with clear instructions. If you live alone, remind your loved ones about this. And if possible, carry one in your wallet, because you never know when you or someone around you might need it. Life is sometimes preserved by the simplest of things, and aspirin is one of them. When you feel the signs of a heart attack, the next thing you should do is not to get water, not to try to leave the room, but to sit or lie down immediately. And most importantly, keep your body as still as possible. You might think you need to get up, open the door, or look for someone to help. But your heart at that moment is working harder than usual just to keep the blood flowing. Every step you take, every bit of exertion, adds more strain to the heart, and that can make your condition worsen faster than you think. Sitting down or lying slightly on your left side, if it's not uncomfortable, helps reduce pressure on the heart, stabilize blood circulation, and lower the risk of fainting. In emergency care guidelines, this is considered one of the most important actions before help arrives. Imagine your heart as an overloaded engine. In this moment, you need to turn off all the extra functions so it can focus only on sustaining life. And the way you help it is by staying still, breathing steadily, and letting your body rest as much as possible. Here are the specific steps you should take at that moment. 1. Sit down gently, ideally on a chair with a backrest or on the floor, leaning against a wall. 2. Do not lie flat on your back if you feel short of breath. Instead, lie slightly on your left side or in a half-sitting, half-reclining position to ease the heart's workload. 3. Keep your head elevated above your heart if possible. This helps improve circulation. 4. Avoid walking, climbing stairs, or doing anything on your own. Just focus on breathing steadily and wait for emergency responders to arrive. Many people make the mistake of panicking and trying to do too many things when they feel unwell. They want to find their keys, call their children, open the door, but those very actions can push the heart past its limit. Sometimes the best thing you can do is nothing at all except to sit down and breathe. And if you live alone, take a simple step to prepare in advance. Choose a safe resting spot in your home where you can easily sit or lie down if you feel unwell. Close to a phone, with access to a remote door lock if possible, and in a well-ventilated area. Caring for your heart isn't always about big actions. In a life or death moment, it's the stillness, the correct resting posture, and the calm mindset that may be what keeps you alive. After you've called emergency services, chewed the aspirin, and sat or lain down to rest, there's one simple yet incredibly important action that can help medical responders reach you faster. Unlocking your front door. You might think, I'm having a heart attack. How could I possibly have the strength to get up and unlock the door? But if you're still conscious and capable of walking a few steps, unlocking the door early can save precious minutes for the emergency team. And in many cases, those few minutes are the difference between life and death. Emergency personnel do not have the right to break down your door unless there is a clear, immediate threat to your life and no other way to access you. This means that if you pass out after calling 911 but haven't unlocked the door, the response team may be delayed while waiting for the police to arrive and assist in forcing entry. In a situation where your heart stops beating, a few minutes of delay could take away your chance of full recovery or stop your heart permanently. If you're alone and feel your condition worsening, try to unlock the main door immediately after calling emergency services. If you live in an apartment with an electronic entry system, activate the remote access feature. If there's a safety latch on the inside, remove it. If you have pets, make sure they won't block the path. Here are some small preparations you can make ahead of time while you're still in good health. 1. Always keep your front door key in an easy-to-reach place, near your phone or by the door. 2. Post a note on your door stating, "An elderly person lives alone inside." This helps emergency responders quickly assess the situation. 3. If possible, Install a remote-controlled door unlocking system or share your electronic entry code with a trusted nearby family member or friend. 4. Make it a habit to unlock the door right after calling 911, only if you are still alert. Afterward, you can return to resting as previously advised. Unlocking the door might not be the first thing that comes to mind in a medical emergency, but for emergency responders, it's the pathway to reach you, the fastest and most effective way. Don't let a locked door, no matter how secure, become a barrier between you and the chance to survive. Prepare for the worst-case scenario so if it ever happens, you'll know exactly what to do and help others help you. During a heart attack, every action needs to be simplified, and one small step that can help you stay calm and respond better is turning on the speakerphone when calling emergency services. This not only helps you hear the 911 dispatcher more clearly, but also frees up your hands to carry out other important actions, such as sitting down, chewing aspirin, or unlocking the door if you're still able. When you're in a state of panic, holding the phone tightly to your ear can add physical and mental stress. In contrast, using speakerphone helps reduce physical strain, keeps your airway clear, and allows you to follow instructions without needing to keep the phone against your face. Moreover, if you lose consciousness while the call is still active, the emergency dispatcher can still hear ambient sounds, assess the situation, and guide medical responders more effectively when they arrive. A particularly useful feature on smartphones today is the medical ID. This is a health profile you can set up in your phone's health app, such as Apple Health on iPhone or Samsung Health on Android, which includes name, age, blood type, pre-existing conditions such as diabetes, high blood pressure, allergies, current medications, emergency contacts. Emergency responders can access your medical ID from the lock screen, even if they don't know your phone's password, helping them quickly understand your condition and choose the most appropriate course of action. Here are some steps you should take today. 1. Practice turning on the speakerphone when calling 911 so you're ready in any situation. 2. Set up and regularly update your medical ID on your phone to ensure the information is always accurate. 3. Share this feature with older loved ones so they can be protected too. Post a short guide on how to call emergency services and use speakerphone in visible places, near the phone, on the refrigerator, or in the bedroom. Don't wait for an emergency to learn how to use your phone. Take control of your device, because in a critical moment, a single tap on the speaker icon or one line of medical info displayed at the right time could be your most vital lifeline. In a world of ever-advancing technology, your heart still needs the simplest things to be protected: a phone call, a speaker mode, and a ready medical profile. When a heart attack strikes, the most terrifying thing isn't the pain, it's the panic, the feeling of breathlessness, a racing heartbeat, cold limbs. All of it makes you feel like you're losing control. But in that very moment, you still have an incredibly powerful tool to help yourself: your breath. Slow, deep breathing isn't just a way to calm your emotions. It's a scientifically proven technique that can help regulate your heart rate, lower blood pressure, and stabilize the sympathetic nervous system. In a crisis, proper breathing becomes your safety switch, helping you stay calm enough to carry out the next steps more effectively. The breathing technique you should apply is called 4-6 breathing. Inhale gently for 4 seconds, feeling the air move through your nose into your lungs. Hold your breath briefly, if possible. Exhale slowly for 6 seconds, through your mouth or nose, trying to relax your entire body with each out-breath. Repeat this cycle at least 4 to 5 times, or until your heartbeat feels more stable and your mind less panicked. You don't need to force deep breaths. What matters most is steady, slow breathing. Why is this simple technique so effective? Because when you panic, your body activates the fight or flight mode. Adrenaline surges, heart rate spikes, and breathing becomes shallow. But when you intentionally control your breath, you're sending the opposite message to your brain: this situation is under control. That reduces the stress response, helps oxygen circulate more efficiently, and keeps you conscious during those critical minutes. This is one of the simplest techniques. No equipment, no cost. yet it's incredibly effective at pulling you out of the spiral of panic when a heart attack hits. To be ready, you should. 1. Practice 4 to 6 breathing for a few minutes each day as part of your mental wellness routine. 2. Post breathing instructions in visible places like the fridge, bathroom mirror, or bedside table. 3. Share this technique with loved ones, especially older adults, so they too know how to stay calm in an emergency. Your heart needs oxygen, but more than that, it needs you to stay conscious. And there's no better way to keep your clarity than through your own breath. Inhale for 4 seconds, exhale for 6 seconds. With each breath, you move one step closer to life. Thank you for spending your time with me throughout this video. In a fast-paced world full of distractions, the fact that you pause to care for your health, and especially your heart, is already a deeply meaningful act. If this video brought you something, a piece of knowledge, a bit of inspiration, or simply a gentle reminder, I'd love for you to share your thoughts below. What did you learn today? Which part felt the most important to you? If you found this content helpful, please share it with your loved ones, friends, especially those over 60 who are living alone. You might just be giving them a precious chance at life. Stay with me in the upcoming videos, where we'll not only talk about risks, but also learn how to live healthier, more positively, and more peacefully each day. Because you know what? It's never too late to start living fully, especially when you can still hear the beat of your own heart.